It's a medical fact that after the age of 50, hormone imbalances can lead to a poor sex life and a higher risk of heart disease and stroke. I'm Dr. Laura Ellis, and with MedAge, I help men and women live happier, healthier lives using a highly customized program of exercise, nutrition, natural supplements, and clinically approved bioidentical hormones. Give me a call. It's time to take care of you.
Welcome back. Well, today we have Laura Ellis, MD, on with us, and she is going to be talking about vein disease and her center down there in Laguna Beach, Laguna Aesthetics and Vein Center. Nice to see you again.
Thank you very much.
When we talk about vein disease, I think most people think right away of varicose veins, and of course that is one part of it. But it can be a sign of a lot more serious things, am I right?
You're right. Actually, I think a lot of people think about spider veins, which are just a cosmetic issue. But varicose veins are a medical problem. Mm-hmm. And you're right, they can lead to other issues. They're not just a cosmetic concern,
right.
Although they don't look good.
No.
They can cause other problems such as skin conditions and blood clots. It's a big one that most people worry about. Yeah.
What is actually happening when you have this kind of, when you have vein disease or varicose veins, and why all of a sudden do they sort of appear? Like they seem to come to the surface.
Yeah. Well, they sometimes are symptomatic before they're visible, or vice versa. Sometimes they're visible before they're symptomatic. Varicose veins are bulging, ropey veins in the legs that are caused by a valve dysfunction in the vein system of the legs. And it's inherited. So it can occur early in life and progress as life goes on, or it can suddenly become symptomatic and obvious, but it really existed for years prior.
Okay.
Yes.
Besides the obvious aesthetics of it, do people feel discomfort?
They do. Typically, it's leg heaviness or aching, restless legs at night, leg swelling, actually frank pain, but it's not like a sharp pain. It's a dull, aching type of pain. And a lot of people tell me that what they notice is that they have this urge to prop their legs up when other people may not. Say they're out shopping or they're being active in some form. Yeah. And they feel that they need to sit down and put their legs up because of the heaviness and the aching and the fullness. Now,
the seriousness of this is that there's a risk of blood clots. And is that because problems with the valves, things aren't circulating properly?
That's true, yes. Things aren't circulating properly. When the valves are dysfunctional, leg veins are like simple plumbing. Blood in the leg veins goes up toward the heart. Arteries bring it down in and veins take it back out. So so vein blood is flowing uphill when you're upright. Yeah. So just like simple plumbing, there has to be a pump behind the system, and that's the calf muscle in the foot. And then there have to be valves in the system to prevent the flow from falling back down when the pump is relaxed. So it's typically the valves that are the problem. And you can't fix these valves, and you don't need to fix these valves. You need to simply remove the veins that are causing the problem. And there are plenty of veins in the leg, so that when you remove these veins, the other veins that are working properly take over and the flow goes out normally without falling back down.
If something is not done, can you also have pooling of blood in the feet?
Absolutely. It's like the river backing up into the creeks. The creeks are going to swell and new tributaries form. So you see all these new veins that really shouldn't be there. Those are abnormal veins that shouldn't be there. So we used to, in the old days, strip those veins out, but we don't do that anymore. Now we use a less invasive technique that's done in the office under a local anesthetic, and it's with a laser, and it seals the veins shut. And so we don't actually have to strip them out. When I say remove the veins, effectively we're removing them from circulation, which improves circulation.
So years ago, and maybe they still do in some cases, you literally, a surgical procedure, you're removing that vein.
Right, exactly.
Okay.
And that was really a very invasive and uncomfortable procedure.
I can imagine.
Yeah, a long recovery. So people think, oh yes, my aunt had that done, I'm not going to do that. Well, it's different these days. And really you should do it. If you have symptomatic varicose veins, you run the risk of having other medical problems because of them. So fixing them is smart.
Okay. What as far as you said, you stop the circulation to those veins is what really is happening.
Yeah.
Does the body respond to that pretty immediately to find different routes?
Immediately reroutes. You don't lose blood during the procedure.
Okay.
That blood that's in that diseased vein simply moves into other veins, and it's effectively moving back to the heart to go into normal circulation.
Okay.
So when it's pooling like that, that's when the risk for blood clots develops.
Right,
Because
exactly.
blood, when it's not moving, may clot, and then those clots can move to other areas of the body and cause problems.
Okay. What about in severe cases? Are there times that instead of 1 or 2 veins, I don't know what the average is, somebody may have a dozen? I may be exaggerating, but
typically there's 1 or 2 or maybe 3 source veins. We call that the primary problem. Those are the veins that we see with the laser. The bulging veins you see in addition to those source veins that are underneath the surface are the tributaries.
okay.
Those are the true varicose veins where the source is a little bit different. The source is what we used to strip. We laser it. We may take out little tiny pieces of those bulgy veins, but that's not stripping. That's called a phlebectomy.
Okay.
So that you don't have those anymore. Remember, they're abnormal. And by leaving them there, they pose a problem where blood may pool and clot.
Okay. So those would be possibly surgically taken out.
Yes.
Okay.
Yes. And then it looks like your leg doesn't have any bulging veins anymore. So there is a cosmetic improvement, which is, I think, why some people think that this is a cosmetic problem.
Okay.
Because yes, your legs will look better. They'll look normal afterwards. But we don't do it for that purpose.
Right. It's the underlying medical problem, the
Right.
more important problem.
Right.
What is the recovery time?
Patients leave our office, they walk out, they get in the car, prop their leg up for the rest of the day that day at home, and then they go right back to regular activity the following day.
Oh, wow. So it's very,
Very quick, back on the feet.
What about being covered by insurance, Medicare?
It's well covered by insurance. Medicare covers it.
Because this is a medical,
Because
not
it's
cosmetic
a medical.
issue.
That's
Okay.
exactly right. That's exactly right. So it's covered well.
Great. Now, if someone feels they have a problem with this, if they're on a Medicare plan, an HMO type medical, they'll need to go to their primary first?
No, not at all.
Oh, really?
They can come directly to me.
Oh, that's fantastic.
They don't need a referral.
That's
I
really
take care of
good.
everything, and from our office we get approval if their insurance company requires approval. Medicare doesn't. We just go ahead and proceed.
That's fantastic. Very good. And you're in Laguna Beach, right?
In Laguna Beach on South Coast Highway
Okay.
at Laguna Aesthetics and Vein Center. And patients can simply call, schedule an appointment, and I'll see them.
All right, I have the number on the screen, 949-632-8087. That's wonderful that people don't need a referral. They can just, they can get a
absolutely.
consult as well?
They can get a consultation from me. I am a general surgeon.
Okay.
I've been doing varicose vein surgery for many, many years.
Okay.
I learned this modern vein technique from the founder, the father of vein surgery, modern vein surgery, and have done many thousands of cases.
Great, so you'll be in good hands.
Yeah, that's right.
That's it's great, and the importance of that is, of course, yes, you don't want to have your legs looking that way, but of course the importance is the medical conditions and the seriousness of it that it can cause. Good to see you again.
Thank you very much. It's good to be here.
All right, we'll see you again, and
Okay.
we'll be right back. Is that?
Varicose veins hurt and can lead to blood clots, and they're unsightly too. If you have painful leg veins, now you can do something about it. I'm Dr. Laura Ellis. I'm a vein surgeon, and for over a decade, I've helped men and women live happier, healthier lives. With a comfortable laser procedure in my office, you can go back to normal activities the next day, and it's covered by Medicare and most insurance. give me a call. It's time to take care of you.